The new health care reform law is more than 2,400 pages long. It is complicated, confusing, and all this week we've been taking a close look at what's in it. Tonight, Chief Investigative Correspondent Armen Keteyian tells us what it will mean for insurance company in our user's guide to health care reform.
Under the new bill, the health insurance industry stands to gain up to 20 million new customers, but will be required to spend at least 80 to 85 cents of every dollar it takes in on health care, eliminate lifetime limits on coverage, and restrict annual limits, pay at least $70 billion in new taxes beginning in 2014, and sell insurance through state-run exchanges, making purchasing more affordable for individuals. In addition, insurers will be prohibited from charging older Americans more than 3 times what they charge the young, canceling policies when people get sick, and perhaps most importantly, beginning in 2014, insurers will no longer be allowed to exclude the 12.5 million adults with pre-existing conditions, people like Andrea Imhoff, who has suffered from asthma and mild depression.
I got denied twice and I had to wait. I got scared and I was frustrated too because I couldn't afford to really pay for these medicines.
Industry leaders expressed concern about the bill, charging it does little to improve quality or contain the soaring cost of health care, up 131% for families in the last decade. But overall,
we will have more people covered, which is good. You have greater revenues. But on the other side, you actually have these premium taxes, which will really offset the revenues. So altogether, from a profit perspective, probably neutral.
Even if the revenue from all the incoming customers doesn't completely offset new taxes and services, industry profits aren't expected to fall by much. That's because despite tougher regulation, any additional costs will most likely be passed on to policyholders in the form of subtle rate increases.
There will be some modest premium increases as a result of this. I think it will be phased in very slowly over the next decade, so it won't be something that's dramatic and clearly visible.
What is clear, all these changes haven't worried investors. Before the bill passed, health insurance stocks were up. A vital sign the long-term prognosis remains strong. Armen Keteyian, CBS News, New York.
And you can find more of our stories from our user's guide to health care reform online at cbsnews.com.